The Executive Director of the National Primary Healthcare Development Agency, Dr. Faisal Shuaib, said the agency has added a lot of effort in the last few months so that the 10 million doses of COVID-19 vaccine would not expire. Dr. Faisal Shuaib made this known during COVID-19 mass vaccination of refugees, migrants, and internally displaced persons in their camps in Abuja. He expressed gratitude to all health workers in the country for their diligence in vaccinating millions of Nigerians.
Recently, we heard that 1 million doses have expired. Is that correct?
That is correct. We've had up to over 30 million doses of vaccines in Nigeria. All of them have come with short shelf lives. We've been able to vaccinate over 10 million Nigerians with these vaccines that were brought with short shelf life. When they are brought with short shelf life, there's a subtle acknowledgement even from the donors that some of them might end up being expired. So for example, the last batch that got expired, some of them got here just 5 weeks before their expiration date, right? Now when you compute the amount of time that NAFDAC will take to make sure that they are certified, and then all of the preparations to make sure that they get into the field, little wonder that some of them will get expired. We have tried in the last few months to make sure that over 10 million doses did not expire. I think the focus really should be on the unsung heroes. Who are the unsung heroes here? The health workers who have had to work Saturdays and Sundays to make sure that vaccination all over the country continued, trying to meet and beat this deadline for this short shelf life. We're in a situation where developed countries hoarded these vaccines for several months, right? When the vaccines are produced, they have shelf life of up to 12 months. But if we are now getting them just 5 weeks before they expire, you can imagine the kind of effort it takes. We have not complained in the past about all of the challenges that comes with having to get these vaccines out. The frontline health workers, who are the heroes of the COVID-19 response, have been working round the clock to make sure that these vaccines get into the arms of Nigerians. The focus should be the fact that they've done such a tremendous job, not on the fact that Nigerians got short shelf-lived vaccines and that 1 million doses expired. We are trying and playing a very critical role in the global community. The reason why they bring some of these vaccines to Nigeria is because Nigeria has the population to absorb the vaccines, and they also know that Nigeria has the capacity to absorb these vaccines. So imagine if Nigeria had not stepped up, if the Presidential Steering Committee, the Federal Ministry of Health and NPHCDA had not stepped up to collect these vaccines and vaccinate. Over 10 million doses of the vaccines that we have utilized in Nigeria would have wasted. So if there's anything, I think we need to commend the average health worker in Nigeria for being so hardworking, so committed, working extra hours, working around the clock, Saturdays, Sundays, going to churches and trying to get the vaccines out there. We will continue to do the job irrespective of the kind of press that the health workers are getting. The leadership provided by Boss Mustafa in the Presidential Steering Committee, the Honorable Minister of Health, Dr. Osage Ihanire, has been sterling, and this is why quietly health workers have been doing this work, because they have provided the leadership. They know that this is a job that has to be done, and they've been doing it quietly and using these vaccines quietly. So I think that should really be the focus, to say thank you health workers for making sure that we vaccinated over 10 million Nigerians with vaccines that otherwise. So the vaccines that got expired were of the AstraZeneca type, right? And these ones arrived in Nigeria around 5-6 weeks before expiration. Despite the best efforts of the health workers working around the clock to get them into the arms, it was not possible because health workers provide health services. They don't actually do magic, right? It will have been magical for them to do anything beyond what they have done. So we appreciate and acknowledge the work that the health workers have done. In terms of the impact on the COVID-19 immunization program, we do not expect it to have a negative impact. Immediately, we recognized that the vaccines were going to expire, we withdrew them from the field, and we've withdrawn them with the aim of destroying them. This is a normal practice. This is why we did not make a lot of noise about it. We had the option, of course, just like the Honorable Minister of Health has communicated, of extending these vaccines by 3 months. This is standard practice, and I'm sure that even the layman is aware of this. But because of the high and rigorous standards that we have placed on vaccines and other medicals in Nigeria, we refuse to take that option of extending the expiry date. Immediately it was time, we withdrew them and we will destroy them. We know that Nigeria has scarce resources, but our resources are not so scarce that we will begin to extend expiry date. We hold the issue of vaccination to the highest degree, and we will continue to ensure that only potent and safe vaccines will be given to Nigerians. This is something that we hold very true. We see this as our moral responsibility, and we discharge it with the highest level of responsibility.
Can you talk to us briefly about the penetration in the rural communities?
Right. So you will recall that a few months ago, we were struggling with the challenge of access to vaccines. A few months ago, we were even celebrating that we were going to get 100,000 doses of Pfizer vaccine. And then when it didn't come, everybody was disappointed. Now, we have moved so far from that situation that we now have adequate vaccines to get across to Nigeria. This is why we have now even expanded the scope in terms of the number of health facilities that now have the vaccines. We have now involved the private sector. But beyond that, we have also established mass vaccination sites. I'm sure you can go around and see some of these mass vaccination sites, including mobile sites. This is a testament to the fact that the vaccines are now available. So we are now pushing hard into the interior to make sure that every single person, no matter where they are, is not left behind in terms of their access to vaccines. One thing I would say is that COVID-19 is now a disease of the unvaccinated. Over 7 million Nigerians have been vaccinated. These Nigerians should seize the opportunity to also speak to their family members, to their friends, and say, these vaccines are safe. These vaccines can protect you against severe disease and death from COVID-19.
This partnership with the National Healthcare Development Agency is the main strategy. We're going to work hand in hand with them to ensure that every camp and every settlement and the host communities have access to COVID-19 vaccine. I don't think that we need to incentivize, looking after our health, but when we get in touch with these people, we try to give them a few relief items. But we don't have to incentivize vaccination because it is key, it is important, it is the best thing for all of us.
Well, as you know, WHO has issued temporary recommendation under the International Health Regulation, and we recommend to countries to apply a risk-based approach. It's really up to every country to assess the risk to its population and to put in place related measures. But what is required for countries is to inform WHO through the International Health Regulation mechanism on these measures. So we recommend a risk-based approach. It means countries need to look at the readiness, the preparedness to deal with any threat, even beyond COVID-19. And if a country feels that is not prepared to deal with an influx of sudden increase of cases, for example, they may put in place the measures based on the risk assessment done in that particular country. But WHO do recommend that those measures be informed by actual risk rather than anything else. Well, I'm assuming this is a question to ask to the authorities who are managing the vaccine. But as you know, the vaccine that were produced were authorized under emergency use list, and they were being produced with relatively short half-life, you see. So they have a very short expiry date, and they were being shipped through different mechanisms, including the COVAX, and the countries were expecting to ramp up the vaccination effort. But because of the short half-life, country may not have, all that it takes to use them up within the short period of time. Under normal circumstances, when medicine or vaccine are shipped to countries, they should have at least at least 1 to 2 years of shelf life. So if they arrive within, say, 3 months or less of expiry, we might expect some of those vaccines to be lost. But what is most important is to commend the country effort to ramp up the vaccination, to make sure that everybody is covered. And I'm sure we all learn from our experience, and I'm sure we'll make sure that next time we work with countries to ensure that we put in place staggered delivery so that we can accept medicine or vaccine based on likelihood of consumption, but with an appropriate half-life. So that's what I can say for now. It's an experience we've seen, and it's not only in Nigeria. We've seen that in many other countries. This has happened, and COVID-19 is new. COVID-19 vaccination is new. We are all learning from it, and we are sure that we'll take that into consideration, this experience, to plan ahead of this happening.
Goodness, Enemali, GTV Africa.